Hey everyone, it's Dr. Angela Cudger with Legacy Holistic Health Institute. And today we have an incredible special guest. So as soon as you're on here, let us know who you are and where you're located and what it is you currently do. Today we have a very, very special guest who obviously is near and dear to my heart. It is my very own sister, Chantel Cudger. And so,
Hey,
hey Alana,
everybody.
hey, Alana, thank you for joining us. Alana says she is from North Carolina, and she's in the wellness, she's a wellness professional. Okay, so we're going to be talking about senior care today. The reason I thought it was necessary to talk about senior care is because you're going to hear some very alarming statistics today that will help clue you into this particular community. Now, you guys know that this channel is all about people who are marginalized, people who are minority populations, and of course, men, because these are the populations that when it comes to health and wellness, they almost get forgotten about. Now, one of the populations that are at the top of being marginalized is the senior care population. So if you're someone and you're over 35 years old and you have parents or grandparents, people who you're looking after, or you know that they're going to age, or you yourself are approaching that age as well, make sure you share this so that other people can get this information. This is definitely going to be that live stream that you save and come back and watch again later to take notes from. All right, Chantel, I'm going
Mhm.
to turn it over to you. My first question to Chantel, and you guys, as we go through this, make sure that you put questions in the comments as well. Chantel is a walking wealth of knowledge when it comes to the senior and assisted care and even memory care industry. And we're going to talk a little bit about the gazillion credentials that she has, you guys. And so I want to first talk to her about, how did you get into senior care? How did you end up in this industry? And we grew up together, right? So we have the same parents. And so I want to know how you got into senior.
Well, for me, it wasn't one of those quintessential fairy tale type stories. I, had grown up taking care of people all my life. I had done mission work overseas and stuff like that on my spiritual journey. I had worked for Hewlett Packard Corporation for about 13 years. And during that time, the economy went belly up. A lot of layoffs was going on. I was one of the people that got laid off at that time. So I initially entered senior care because our younger sister was already working in senior care as a program assistant. So I would go in to volunteer with her. Now, I didn't qualify to apply for any of the jobs there. I tried as a program director because of my volunteer efforts and my philanthropy work, and I didn't qualify. So they offered me a housekeeping job. And of course, I was not excited about that role at all. But it was God's way of putting me exactly where I needed to be at that time. So it was more than just a professional journey for me. It was part of my spiritual journey too. So I started working as a housekeeper. I started connecting with the residents on that level. And I started interacting with the residents on that level with activities and exercise and just spending time with them each day. So I started to take on that role as a housekeeper, but I saw past the title I was wearing, and I understood that I was there for a higher purpose. So I've been in the industry for 16 years. At this point, I moved on to be an assistant program director and currently a program director, as well as many other things. So that's how I technically got my start in senior care. It was kind
Now,
of like stumbled upon in a sense.
I think that's amazing. And I got to be honest, Chantel, I don't remember who worked in the senior industry in our family. So you have to who that was. And
Okay.
I want to talk a little bit about the different kinds of certifications that you have, because you have several different certifications that are specific to this industry. So this is more, way more. I kind of jumped into this. There are a lot of people I think that enter this industry and they quickly exit because they don't necessarily have the heart for the work. But I
Mm-hmm.
feel like if they knew that there were other avenues for tremendous growth, that they would look more at this industry. And so I want to
Mm-hmm.
talk a little bit about the different certifications that you have that you think are essential for someone who says, well, I'm interested in that industry, or I'm interested in being a part of this, but I didn't know there were other certifications that I could get to learn how to take care of other people as they age or take health. And so, can we talk a little bit about what those certifications are?
Okay. So one of the first certifications I got was my dementia practitioner certification. And I didn't know what that was. One of the organizations I was working for at that time, this was maybe around 2011 or something like that, were offering it to their directors, all their management staff. So the certified dementia practitioners certification is an in-depth training. It's an 8-hour seminar where you get extensive training to be able to, and this for healthcare professionals, anybody that's a healthcare professional that works with seniors. So it gives you in-depth training for people with Alzheimer's and dementia, how to interact with them, how to engage them, how to recognize behaviors, how to preserve their dignity. If any credential, I would say that is the top credential I think every healthcare professional should have. There have been so many times where I have worked with my residents and I have had to accompany them to doctor's appointments, and the doctor is not familiar with how to engage a resident with dementia. They carry on conversation with them as though they are normal, and then they have that moment. Then they can have those moments where they speak with clarity and they seem like they're all there, depending on what stage of dementia they're in. But then they start veering way off the beaten path, and then that doctor is kind of like a deer in headlights. So I feel like EMS, all of these emergency responders and healthcare professionals definitely need that training because the population is truly aging and more
Yeah.
people are developing Alzheimer's and dementia. So in conjunction with that credential, I decided to get the certification to be able to train people. So I'm a certified Alzheimer's disease and dementia care trainer as well. So I can provide the training for people to get the certified dementia practitioner credential also. I've also taken senior living management courses at Cornell University, which walks me through workflow optimization type things, how to design a community so that it properly engages the residents and things like that, how to look at the design of a menu and what type of foods to offer, why you design buildings certain ways, how they can connect with nature in those spaces, and the benefits of all of that. So I took that course at Cornell. I recently received my license as an assisted living care administrator and a personal care home administrator here in Georgia, which means I'm licensed to manage those types of facilities and manage the staff in those facilities.
I love it. Talk about going from housekeeping all the way to where you are now. How does that feel looking back and saying, wow, like,
You know what? When I first started in housekeeping, I had every regret in the world. I felt like I was at the bottom of the barrel. I knew too much. I was too, intelligent. I didn't have the necessary credentials per se for assisted living, but I knew that I had something to lend to the people in those communities, both staff and residents and families. So when I look at that now, I see how necessary it was for me to be in that position because it gave me the best perspective possible on what is needed, number one, for the residents and for the staff, for the families. If I had started where I am now, I don't think I would have had that understanding. And I say that because you consistently see that in the industry where there is no connection. And then you said, you have to have the heart for this, and you do. That is the basis for it. You have to have the heart. It's a heart-based business.
yeah, yeah, it's definitely heart centered. And it's one of those things, I gotta say, I don't think AI is going to ever take the place of much in senior care because it is
No.
so heart centered, and because each person and how they might manifest dementia or Alzheimer's is
Mm-hmm.
just different. You know,
Yeah.
it would take a long time for something like AI, AR and VR to catch up to that when we're talking about technological advances, right? Especially even tech advances in care. that can pick out and diagnose things. People are just showing up with so many kinds of ways that something can be diagnosed. It's a field that I feel like is just wide open. And a lot of people in healthcare, especially in health coaching, they look flat over this field, and like they normally do for most marginalized populations, LGBTQ, people with disabilities, people who are seniors. They look right over them.
Well, I think when it
These
comes to
industries.
seniors, people see senior, we see them as old people. Old people, we don't think they have a purpose. We don't think there's still any life left in them. And these are very much accomplished individuals, and they still have a lot of life in them. It just takes somebody it takes the right person to intentionally bring that out of them, to connect them with that. And then they are exploring things with AI and care for people with dementia. We do VR with some of our residents, so they do engage in virtual reality meditation classes and games and stuff. We do those things too, but again, it depends on the resident. It depends on the type of community. Like you said, if we're talking about Alzheimer's and dementia, if it's early stage, some of those people may be able to engage in those. When you start talking middle and late stage, not so much.
Yeah. I don't switch gears. So now we know where you came from, right? And where you are now. And so and you're over Encore. So I want to, if you can explain a little bit about what does Encore MCS do? What is, because with your expertise, I could see so many different organizations needing the assistance. I know you've worked with me on federal projects. So I want to talk a little bit about what Encore does and what made you create Encore.
So Encore Management and Consulting Services is a business that I started actually during the pandemic. Having been in the assisted living industry for so many years, I have worked with some of the top companies in the industry. So I get to get that bird's eye view of what actually goes on behind the scenes, and I just saw a lot of stuff from community to community, from company to company. Everybody was doing the same things wrong, and it began to look like more of a numbers game. And so I went into it because it's a hard business for me. It is what I love to do, is where my passion lies. So, which is why I'm still here. So I created Encore so that we could provide the proper training and consulting to individuals and organizations, and even these government agencies, because they need to be a lot more forward thinking about how can we effectively care for these residents, not just hold them in these communities, but give them the quality of life that we advertise. And having been a program director, which means I was hands-on with the residents all the time. I created everything they did from day to day, from exercise in the morning to out of town trips to lunch outings every week. All of the stuff they did, family events, community events, I was the person that was responsible for that. So having done that successfully for so many years and just being myself in that role, I saw how easy it was if you were somebody who really understands the need and actually has the patience and true passion to actually see it back for these residents.
I love it. I love it. I love it. I love it. So now we're going to switch gears a little bit, because I know there are people out there, and if you guys are here with us and you have individuals around you that are aging, or you yourself have questions about aging and what your care is going to look like, let's face it, a lot of people in the US are living longer, right? A lot of people are living a lot longer than they used to. And we're becoming one of the older countries. And I don't mean just older historically, I mean older as in the types of people who live in the country are over 40, over 50, right? We're an older country versus younger countries on other continents, where the average person is 30 years old, or the average person is in their 20s, right? So the US is not a young country. We have individuals who are having fewer children. Families are a lot smaller than they were, right? Like we're both one of 11. So
Yeah.
Not a lot of families like that that are having several generations within a family, and we were talking about that. But I want to talk a little bit about the types of environments that people can look for to be able to age properly in. We have a lot of people that grow up and feel like I'm gonna manage my parents' care at home. I'm going to, but one of the things that they don't think about is caregiver burnout, which is
Mm-hmm.
very real. It takes a
Mm-hmm.
lot to be a complete caregiver to someone else as they age. And especially if you don't have the expertise to give that care, it makes it that
Mm-hmm.
much more challenging to give them
Mm-hmm.
everything that they need. And so now, if someone has the opportunity to select an assisted living or senior care location, can we talk a little bit about the types of environments? Because I know people are scared because Chantel, they see these videos where they're hitting people, they're slapping them, they're mistreating them, they're not bathing them. And so when we think about how we treat our senior society in the Western world, it's bad versus how people in the Eastern societies treat their elderly or treat their seniors. But I want to talk a little bit about when someone is choosing an environment. I'm looking for somewhere to go. What am I looking for? Because we know the tours are set up to sell, right? We're all
Mm-hmm.
marketing something, right? And
Mm-hmm.
so I want to talk about if someone is on a tour, what do they look for when they're walking in these buildings and they're getting ready to select a place?
Okay. So the one thing I will say, because when I came into the industry and I saw a lot of the negative stuff, it's easy to get kind of, swayed by that and say, okay, everything is bad in this industry, everybody in this industry is bad. What I will say is, yes, caregiver burnout is very real. And that's whether you're providing personal care at home to a loved one, or you are a CNA, a nurse, or somebody in the senior care industry as a professional. But also, there are some phenomenal people who work in the industry. There are some, but they do experience burnout. They are overworked and underpaid. That's the reality. It just is. So when you're going into these communities, yes, we're going to set up these tours and we know exactly where we're going to take you and what we want you to see. The best thing you can do is ask questions. Ask questions. I'm telling you, write those questions out before you go. And I don't care if you have to memorize them, you have to write them down and write them as you go. Ask those questions as you do the tour. So as you're going, don't just listen to what they're saying to you. Look around intently and intentionally. Look around that community. What do the residents look like? Do they look like they're well kept? What is the interaction between staff to staff? What is the interaction between the staff and the residents? Is it only one or two people like your activities, your program director, somebody like me that's interacting with those residents, or is it the whole community? Where's the management? Are they visible? Do you see pictures of the residents on the wall or in the community anywhere that gives you an indication of what they do? Now, we do have social media pages that you can look at, but here again, when you're thinking about social media, it's a snapshot. Every resident doesn't want to be on social media. And then we have to abide by HIPAA laws, and they have the right to say, no, don't take my picture, don't post it. And for the safety of some of our residents, because they have led some very incredible lives. So you want to look at that. I always, as a program director, I work with my marketing director. One thing I ask them is, can that family come and spend a day in our community? Because I want them to know that we don't have nothing to hide. Let them come spend the day, or you can ask, and most communities allow you to do this. They'll allow you to come and have a meal there. They won't charge you for it. They'll allow you to attend an activity there. And when you are there, pay attention to what is going on. Have your ears open, have your eyes open. And I'm telling you, there's some gorgeous communities out here. They look like palaces. You have to get past the aesthetics, because they are building these places now so that they are aesthetically pleasing. But it's not always necessarily for the loved one you're moving in. That's to reel you in. You can say, oh, this place is beautiful. They got this, they got that. But you know your mom or your dad or your loved one's level of care. So pay attention. It's a beautiful building. But if I know my mom used an assisted device, she's in a wheelchair, she uses a rollator, is this furniture conducive to her? Can she sit in that? Is she going to have a hard time standing up? Pay attention, ask questions. Okay, if the person that's doing the tour with you, how long have they been working there? What is the consistency of staffing? How long has the current manager been there? Some communities, you'll go to these communities and they will tell you, oh, we've had people in our community for 30 years, employees for 30 years, for 17 years, for 20 years. So that's a great sign. So you want to ask that question too. And I always tell people, turn on your five senses. What do you see? What do you hear? What do you smell? Even if it is a memory care community and you have people with incontinence issues, it should not smell like that when you walk in, because it tells you something about that community. Their level of care, it tells you something. How do you feel? Is it too cold? Is it too hot? Look at those things too, because some of these buildings are beautiful, but they're old buildings. The communities are old, and we just, you dress them up, you make them look nice and stuff, but is it too cold and it's wintertime? Why is the heat not on? Is it too hot and it's summertime? Pay attention, turn those five senses on and pay attention to more than the price and what the decorations on the wall and the furniture look like, because these places they are gorgeous. They're pulling out all the stops, but you have to be realistic about, what the quality of care they're giving them. What kind of food are they serving? Look at the menu. Two things: look at the menu when you go there. If they have a weekly menu, look for it, so you know what they're serving for breakfast, lunch, and dinner. And if your mom is somebody who was, real serious about her health, she ate really healthy, she's a vegetarian, ask those questions. We have residents who are vegetarian and all that. So you have to ask those questions. They have a renal diet. Does that place, independent or not, will they accommodate that? So look at the activities calendar. It tells you what they're doing all day, every day, what their programming is, see if that stuff aligns with who your mom is. But keep in mind when you do that even if activities that your mom will be interested in are not on the calendar, you can work with that program director so they get to know your parent or your loved one and add some things that would, kind of support what their likes and dislikes are.
Okay.
So yeah,
I love it.
Yeah.
I love it. And I feel like you're right. So you said a whole bunch of stuff. So the first thing was turning on the senses, right? Because when you go into these places again, they could look very, very aesthetically pleasing, and you could be like, I have no idea why Dad wouldn't want to live here. Like this would help ease my mind, dropping him off and moving on about my life and making sure that I spend time with him or her. But moving on, I would feel comfortable with them being here. But again, you want to check these environments out, because a lot of them look really, really great, but you want to make sure that it matches the needs of your family member. Again, and I can't say enough about like the food. And this is where I think, and I kind of want to switch gears now, because this is where I think health coaching can play a huge part. And so I want to talk about, like, and you don't have to go like into specifics about your specific budget. I know that you've worked across different industry leaders with the different companies, and you've always kind of had some kind of budget to manage when it comes to activities and bringing. Basically, she's the person that brings people from the outside, right? And so like one of the things that she recently did for the community that she's at now was the car show, right? Which I was like, man, I wish I was there. And it was just phenomenal to see those things and to bring the community together in that way. And so I want to talk a little bit about how, like if someone were a health coach, how would that budget be used to kind of bring them in? What are some things that you would be looking for from them if they say, well, I can help with food, I can help with behaviors, I can help with some mental issues, I can help with things like that, I can help with a little bit of movement, mindfulness. As a health coach, they can help. A lot of health coaches have certifications in things like yoga, in mindfulness, in meditation. They're dual certified in a lot of different things, and many of them are healthcare providers too, or they used to be. And so I want to talk a little bit about, if a health coach were to call these centers, who would they talk to, and how would they go about like finding a way in? And it was more than I could deal with. It was keep coming back, and I was like, I'm overwhelmed. So when health coaches say, oh, I can't find clients, or I don't know where to go, I'm like, oh my God, like, how am I overwhelmed with opportunities and you're not finding any? And so it can just be that they just don't know, like, in the industry, there's money in this industry. So I want to talk a little bit about that. Who's the gatekeeper there, and who would they need to talk to? And then what would they need to be able to then pass that and say, I'm qualified to get in front of these people who've already lived a very long time and have experience across an array of things. So I can't come in there trying to just blow smoke, right? So I want to talk a little bit about that.
Okay, so that would depend on what they are selling, what they're offering the community. It depends on the community, depends on the community's budget and what you're offering that community. So I'm the program director. A lot of people typically come to me if they want to be seen by families. I always say, hey, come in and do us. I always try to get them to do something free. We have a lot of home health people that come in to initially start, because you're going to gain clients through that. So I will say, okay, like this month is wellness month, or October is wellness month, or whatever the case may be. Then I say, okay, well, let me get some health coaches in. You can do a seminar, you can do a food demo, you can do a yoga demonstration, or do an exercise class, because we pay people to do that stuff all the time. I have somebody comes in where I'm at, they have a pool. So I pay somebody to come in during the summer months, and she does aqua Zumba with our residents. You know, sometimes we do that stuff on a weekly basis. Sometimes we do it on a bi-weekly basis. It just depends on the extent of the budget at that specific community. And most budgets are based on how many people actually occupy the community. So if I work in a community where our max occupancy is 200 residents, but we only have 50 residents, I'm not going to have the budget to hire you every month like that. I may have I can open the door for you to, present your product or yourself and your services. I can open that door, but we may not be able to pay you. But I can also connect you, which I'm good about, and a lot of us are good about in the industry, is connecting you with our sister community. They're all over the US. So if I don't have the budget, and I don't know, my sister community in another city that's not far from us, has full occupancy in the big budget, I'm going to refer you to them and say, hey, add this person to your program. They did something really nice for our residents. And then you may grow from there. Now, we also have, so they can come to somebody like me who's an activities director, program director, life enrichment coordinator. We go by so many names. So somebody like me, and then when we host large events, like dinner events or family events, I let them come set up booths there to introduce their services. At one community, I did a cruise week. So during our captain's ball, I had all the different vendors to come set up a booth to, display theirs. And then I gave each of them during the dinner maybe a few minutes to get up before the families and introduce themselves, raffle something off, tell who they are, and things like that. So you can also go through the nurse or the executive director. Sometimes the nurse or the nurse or the wellness director is a good point of contact, because we have in-service trainings for our staff. So when you go into these communities, don't just think about the health and wellness of the resident. Think about the health and wellness of the people who have to care for those residents, the caregivers. So a lot of organizations now are kind of rolling out these initiatives for caring for the caregiver, because people forget about them or about us. And we need that care too. We need to be healthy and well so we can help keep them healthy and well. So your nurse or your wellness director, or myself, somebody like myself, the program director, activities directors, those would be your points of contact. And usually that activities director will get you on the schedule a little bit faster. Now, the nurse will work with you doing an in-service if there's no charge. Say, hey, I'll gladly come in. Like we've had home health and different people to come in and do like grief counseling for us. And let us to kind of, because we're around people who are dying all the time, and we're getting close to these people, but we still have to come to work the next day, and roll with the punches, even though Mrs. Smith was near and dear to my heart, because I've been here 5 years and she's family to me, know. So the healthcare, the CNAs, they need that. So providing that in-service training and support for them. So make sure your services work both ways. They support the staff and they support the residents, and that way you will have a bigger chance of getting those communities and staying in those communities.
That's amazing. And then so I'm just going to, because I know health coaching, a lot of it in some cases is covered by insurance. So is this the type of work environment that insures or provides insurance for the people who work there? And I know that might be community dependent. And then I just wonder if the people that are there receive things like Medicare, Medicaid, or something from CMS, right? So
Yeah,
is that typically common?
it is. It's very common. So people, they pay for their care in different ways, and that's another differentiator between where you choose to place a loved one and not. People pay through Medicare, they pay through Medicaid, they pay through living wills and stuff like that, retirement funds, veterans, the VA pays for a lot of these people's care sometimes because they're veterans, veteran spouses. So that there's a lot of governmental programs that do support whatever the financial expenses are for that individual. So, but again, it depends on the type of community you are moving that individual into and the needs, the actual care level for that person.
I love it, love it, love it. So if you guys have any questions for Chantel, make sure you put them in the comments and make sure you share this out so that other people can get this information. So I want to shift now to talking a little bit about the signs that a person might be ready for this kind of care. So we've talked a little bit about looking for the types of facilities, and if you're someone who is a vendor, and how you can find your way into support, whether you're a caregiver or not, you can still support and use your knowledge and expertise. Now I want to talk a little bit about, how do I know I need to be shopping for a place like this? And we were talking about this earlier. I have people kind of in my sister circle or my girlfriend's circle that they know that they need round the clock care. That means their family member or loved one has exhibited signs that they need care, something other than what they can provide, because they have to work all day. So I want to talk a little bit about, but they refuse to put them in a home. So I want to talk a little bit about what's kind of that, bottom level. This is where you're going to start needing, where you're going to get to where you're going to need care, all the way up to you don't have a choice. This is beyond your bandwidth of what you could possibly do at home. You need to start shopping, right? So what's kind of the first signs that you start to sense, I might need another expert in here with my parent?
Okay. So again, it depends on the individual. All right. So you have, and I'll go through each type of community and what they do, what they offer, what services they offer. So you have adult day. So if you have somebody who's taking care of their loved one at home, and they have to work during the day, they have errands they want to run and things like that, but they do not want to put mom or dad or their spouse into a senior care facility long term for them to stay there, then you look at adult day. So adult day programs is basically, they focus on activities, outings, things that keep them active, socialization, and all that stuff. But then you come pick them up at 5 when they close. Most often they provide 2 meals a day, a light breakfast, and then they get a lunch, and they're usually typically closed dinner. So you pick them up around dinner time. So that way that person can still stay home. It gives them a little bit of breathing room, and they can live kind of a normal life and not have to worry about mom or dad or taking life away. And it gives them some reprieve as a caregiver. And then when you have people who are early stage Alzheimer's or dementia, they have a diagnosis from their doctor, they are early stage, or even if you haven't gotten them diagnosed and you notice that, okay, mom is confused a lot, dad is confused, he's forgetting things, he doesn't remember my name. It's not like every now and then, because people think that those are normal parts of aging, and they aren't. So it's not, everybody doesn't become forgetful or confused as they get older. So when you start seeing those signs, and you see signs where, okay, I'm noticing mom can't even put her socks on, or it takes her forever before she actually put her shirt on, they need assistance with activities for daily living. So that is when you put them in somewhere that's considered assisted living, where they can get that assistance. They still get they stay there permanently now. They get those 3 meals a day. That's their home. They get assistance with getting dressed, with bathing, with toileting, with doing their hair, brushing their teeth, things like that. So you really want to typically look at that. And like I said, sometimes you can do a what they call a respite stay. where mom and dad can try it out for, or try before you buy kind of thing. They can try it out for a couple of days, try it out for a week, an hour, something like that. But before you get to assisted, you also have independent 55 plus communities where it's kind of like in the high-rise apartment complex community for seniors who are still very independent. They still travel, they still work, they still, go out and have fun with their friends. They just want to live in a community with their peers. They don't want to live in a high-rise, a modern high-rise or modern neighborhood where all these young people live. They want to live somewhere with their peers. They can still be independent and carry on their life. And a lot of times we find people who are downsizing, they're moving out of the family home. There's too much space to maintain, and their kids have gone on with their lives and things like that. Or they just lost a spouse. If they just lost their spouse, that's another way that they kind of get out, socialize with people, their age. When you get to people with mid and mid-stage dementia, where they're wandering, they're leaving the house, you can't find them, they're going missing, they are leaving the stove on, they're doing things that are endangering themselves and other people. They have these changes in behavior, you're beyond past the assisted living. They definitely need like memory care. So they do get that hands-on 24-hour care, but you also have a nurse at the assisted living and memory care communities. Skilled nursing, they have to have a licensed nurse on staff. So some people who live in assisted living, though, they still independent. They just go there because they like knowing that, the comforting knowing that there's 24-hour help staff there, whether it's the CNA or the nurse. If I should need them, they're there. They manage their own medication. Some of them still drive. It really just depends on the needs of the person. But a clear indicator is that confusion and memory and lapse in memory and putting socks in the refrigerator type stuff. So, so yeah.
Okay. So now we know that there's adult day. There is assisted
independent living.
Independent living, right? Because those are like whole subdivisions or apartment complexes where people just want to be around their peers. And then we're talking about memory care beyond that, something beyond that, memory care. Now, do you find that oftentimes people choose the wrong one? And is there a reason why they might choose the wrong one?
Well, I think, I won't say they choose the wrong one. I usually look at it from my professional standpoint. I feel like they're inappropriately placed. And a lot of that is because the family is in denial about where their loved one is. Sometimes they can't afford memory care because the prices vary from each type. So when you got adult day, is of course it's different pricing because you're not there 24 hours a day. And then when you go to independent, that pricing sometimes is less depending on how luxurious it is and what amenities are offered. But when you get more to assisted and memory care, especially memory, that price can be up to $7,000 a month, depending on the type of care they are getting. Because you're doing everything for them. You are their hands, their feet, their advocate. You're everything to these people. You have to dress them, you have to bathe them. You some of them have to be fed by somebody that can't feed themselves. So sometimes it can be the price and the cost of it. A lot of times it's just denial. They can't stomach seeing their loved one in that space. They don't remember them. They're saying things to them that they would never normally say. So the behaviors can kind of set you aback because it's like, why is she saying these things? Why is he saying? So it's twofold. It's a little bit of both. It's the pricing sometimes, and then it's the denial a lot of times too.
And how important is it that someone chooses the right one despite what they might be feeling? Because I know that could be very challenging to get past. So it's like, I know that my budget and mom's retirement or whatever her budget might be, it ain't gonna stretch to $7K a month. Jeez, it might, because the way rent is set up, I know in Atlanta, good Lord, it's expensive. But I know that a lot of people who are kind of in this category, their children are 30s, 40s, sometimes 50 years old, and they have their own lives and things that are going a certain way. So when they see that price tag, it can make them choose the wrong and say, well, I'm going to try adult day, knowing that mom needs assisted care, knowing that their parent or loved one needs, the highest level of care, right?
Mm-hmm.
So how important is it to pick one, no matter how they're feeling or what their budget is, to figure out how to go pay for it? Is that important?
Well,
Like, do you often
yes.
like, is it bad to see someone who should be in like a senior, like high rise type deal, that is kind of stuck in assisted living where people are not as active, or like, because I wasn't the only one that picked it. Does that make
Mm-hmm.
sense? Like my family kind of fostered me to be here, if that makes sense.
Yeah.
So
Well,
how
I would say,
important?
do it's important for family members to be educated and well aware of what their options are, and to do your research and to see what community resources are available. Alzheimer's Association, alz.org, they have tons of information, resources, and things like that. Some of these communities you go to, they have support groups that are free to the family members. So get all the information and the resources you can before you make that decision. Because you do, and if you have somebody who's more independent and they're an assistant, they're gonna tell you, I'm independent. They'll tell you themselves, and they'll tell their
Yeah.
family members, I shouldn't be here. But
Yeah.
but sometimes somebody like me, the program director, I try to pull their purpose out of them. So it's like, okay, well, you feel like you know a little bit more, you can do a little bit more, then it's your purpose to be here to be able to help Mrs. Smith. And then they find their purpose in that place. And like I said, some people are very independent in assisted living. They just like the comfort in knowing that somebody's there to help if they need it. And especially if it's a nurse who knows what he or she is doing. But what you don't want, I think the concern is greater when you have somebody who's late stage dementia and they're in independent living, or they're in, stuff like adult daycares do have CNAs and nurses and stuff too. So they can still help with those ADLs, their activities for daily living. They can help them, with their feet, going to the bathroom and eating and things like that. But it's more important when that person is exhibiting late stage behaviors, because if you have someone who clearly needs a memory care facility, which are usually locked and coded doors, they can come and go with assistance, but we don't just freely let them, leave the building and things like that, because they may not find their way back. So we have coded doors and things like that in those communities. So you don't want that person in a community that doesn't have that protection for them. Because if they're having these lapses in memory, they're just going to be out in the community somewhere. And then we won't know they're missing unless somebody tells us, because there are different rules, laws, and regulations that support each of those types of communities. So the regulations of independent living are not exact when you have assisted in memory. Those are different regulations. So if somebody's independent and their family put them there and they're their own POA and things like that, I can't restrain them in assisted and memory care, but I definitely can't do it in independent. They are free. Of course, we want to keep a close eye on them. And then we keep, having those conversations with the family and discussing better care plans and options to say, when we see they're going too far and they just don't belong because they are exhibiting behaviors progressively becoming more and more dangerous for themselves or other residents, it's a conversation that is had with that family to say, we need to consider another space for them. Now, the good thing is a lot of these organizations look at aging in place, which is keeping that person in a space where they are familiar and they don't have to move from community to community. So a lot of them are threefold. They have independent, assisted, and memory. So that person is aging in place on the same property, just maybe in a different part of that property, and the family doesn't have to look for other spaces to put them.
Good. So, I love that. I love it, love it, love it. What a wealth of knowledge. So I wanna shift a little bit and talk about, and this I guess would be your personal, your professional and personal your professional opinion and personal experience
Mm-hmm.
of how you feel about the overall care of seniors in America.
Well, if I'm looking at it, so it's twofold. So I'm looking at it. So when we talk about caregiving, I'll go back to that. I'm going to point it back to that. So you have to me, it's two types of caregivers. You have the one that's taking care of their loved one at home. It's the family giving that, whether it's a spouse, a sister or a mother, father, whatever. And then you have professional caregiving. So you have the caregiving that's provided at home for seniors versus that is provided in community settings like your assisted memory care facilities and things like that. So of course, if I'm taking care of my mom at home, in most cases, not in all cases, because senior abuse is a big thing too, even from family members. So in most cases, if they're aging in place at home, that family feels a little bit more comfort in knowing that mom is safe with me. I don't abuse mom. I'm not stealing mom's money. I'm not abusing her medications, and all these things are not happening to mom. So that's one type of care, but you don't have the resources or the training to give them exactly what they need so that they can have a better quality of life.
Yeah.
That you can give them more is what I'm saying. And then you have professionals. So whereas let's say you're taking care of your mom at home as Angela, and that's personal care with you and your mom. And then you have me who's in the profession. My ratio by state is 1 to 15. So 1 me to 15 residents with the issue that your mom has. So when people see these, well, what kind of care can you give them? If you have 15 grandmas at home with dementia, what kind of care do you think you're going to give them? Now, you have some phenomenal people, well-trained nurses, CNAs, program directors, executive directors, all levels. And they are phenomenal people, but we're still people.
Yeah.
And if you're doing that day in and day out, you're short staffed for overtime. Sometimes when you look at these videos online, that started from that burnout that we're talking about. And if that's a community that is short staffed, that's why I say when you tour these communities, look at the staffing ratio, ask about the staffing ratio. And be specific when you ask, how many care staff do you have from shift to shift and things like that. So, and then it's not just on that community to take care of your loved one because they are there. You still have to be very vigilant in advocating for your loved one. When you go to these communities and you visit your mom, your dad, your aunt, I don't care who it is, look at them. Is their hair and stuff? Are they dressed neat? Are their clothes dirty? They're still wearing the same stuff from yesterday. Pay attention. And sometimes we tell them, check for wounds, check for skin tears, check for that stuff so that you see if there are signs of abuse, and abuse is not just physical. It can be financial. It can be neglect. It can be a lot of different things. So I think that if I'm talking about the healthcare system in the U.S. for our seniors, there's a great need for improvement.
Yeah.
Because senior care is still a business. So you have people like me with my bleeding heart that comes in for the care part of it, but it's still a business. And that business does have to make money to provide care for those residents. So
and keep calm low while they make their money. So
right.
So
And it's a truth we don't want to face, but that's what it is. And some organizations do it very well. They really do. But then you still have some that are trying to find their way through it. And you don't want to be living in the communities where they're trying to find their way through it.
Yeah, for sure. For sure.
Yeah.
So if you guys have any questions for Chantel, make sure you put those in the comments. So the last thing that I want to talk about, she says, thank you for sharing such valuable information. Hi, Christiana.
Hey, Chrissy.
For popping in here and watching us. And so Chrissy's our niece. So thank you so much for being here. And so I want to, before we jump off, because at the end I want people to be able to follow you on LinkedIn and YouTube and kind of the different places where you are. And we'll put your website and all those things in the comments as well, so people have access to it. But before we hop off, now we've always discussed and looked at moving and living abroad for a better lifestyle. And one of the things I think that's a draw to that is how people treat each other in general. And so if the general public tends to treat each other how much better do you think they treat the seniors in their population? And so,
Mm-hmm.
you know, we recently ran into, there's a bunch of stuff that we ran into concerning like at home care that the VA now pays for, you know,
Mm-hmm.
starting if you're already caring for one person at home, they'll pay you to add other people to the house. If you're an empty nester, but you're still young, they'll pay for you to have people there and in each of those bedrooms and care for them and bring people in. So they're
Mm-hmm.
starting to foster better environments in the United States, like you said, that aren't overcrowded, where it won't lead to that
Mm-hmm.
burnout. So you might have a nurse who, instead of wanting to work med surge bedside in a hospital,
Mm-hmm.
investor, she's at home and all her kids are gone, but she's in a 4-bedroom house that's paid for. So now those 3 rooms plus basement and all those things, that space can be used for different residents. And
Mm-hmm.
it's usually
Mm-hmm.
people that just don't want to grow old alone. And so now the
Mm-hmm.
government has programs that will pay you so many thousands a month for each of those people living there. And these people get
Mm-hmm.
home cooked meals because either you can cook or they just want to be around people that are going to treat them right. And it's just, to me, normal human need. And so I'm glad that the VA rolled out that program and it's available to people, but I think that very few people even know about that. But in this kind
Mm-hmm.
of like, a lot of people are in like financial constraints, especially if you're a single person household. This is something that you could do. You could bring in a couple of people that are sitting at home by themselves anyway, and
Mm-hmm.
you could be paid to help these people. You're going to cook dinner anyway. You may as well
Mm-hmm.
make it a meal for everyone. And so and I think that it would foster a great sense of community. And from the examples that we saw that were shown on the news, these were also mixed race households, you know,
Mm-hmm.
where the people might be one race and the people they're taking care of are another race. And so to me, if we can continue to foster that, we can start to get rid of some of the things that minorities are going through, the
Mm-hmm.
misunderstanding and the misconceptions that's normal in the US. And so I'd love to talk a little bit about what we found abroad, because I know you sent this thing to me and I was like, I didn't even know that existed. But it kind of
Mm-hmm.
goes to show how people value those individuals in society as they age. And now people in the Western world, US, parts of Europe, we're starting to catch on to that, and we're flying half globe. Instead of taking these assisted living tours in the US, we're flying halfway across the world and putting our parents there. And we're like, it's half the amount of money. Like, they
Yeah.
get cared for. Like, so I want to talk a little bit about this caregiving abroad. That is, I think the example we saw was where was
It was
it? Was it in
Thailand
China?
or something. I think he sent his mom to Thailand
I feel
or
like it was,
somewhere to
yeah, I
take.
know it was Asia. But
Mm-hmm.
I want to hear from you, like your personal opinion of what you feel about these things, about people moving abroad, and based on what you saw, because you know a lot of regulations, policy, and we already know. I mean, I can tell you have, you know, living full time in Mexico now, the stuff you think applies in the US, that stuff don't apply here. Like, I could walk down
Mm-hmm.
the street and see someone sitting on the sidewalk doing drugs, where they can't really do that in the US, like out in the open, because they'll get in trouble. But it's just different societal norms and different rules. But what do you feel about taking someone that then needs 24-hour care, you know, post stroke, dementia, you know, chronic care, to somewhere else in the world that's not a hop a quick flight away? You know, you're talking about 10 to 12-hour flights, you plus, you know, flights in time to get to someone if something goes wrong. But I want to hear from you, like how you feel about that in general.
It would depend on what stage they are in when you move them abroad. So if mom is in early stage dementia and you want to take that initiative, you as a family member really have to take that in consideration. If something happens, how quickly can I get to mom or dad or whoever? So you have to look at that, definitively. Now, when I think about I would love to explore. I had started researching stuff about senior care abroad, like initiatives, what they have in place and things like that. And I'm finding that most cultures, you have to think about cultural appropriation. What is our culture like compared to Indonesia, compared to Mexico, compared to these other places, Africa even? You know, how do they look after their seniors? In most cases, they age in place at home, but they still need that knowledge and understanding because they have dementia is everywhere. Alzheimer's and dementia is all over the globe. It isn't just the US. So how are they dealing with that? Are they dealing with it? What can we add to what can we borrow from them and what can we share with them? So I look at it that way as reciprocity. So I'm all for moving abroad because I want to move abroad. So I'm all for that because I believe these cultures do have things to offer that we don't have. Just the air they breathe, being able to grow their own food naturally, not GMO modified and tainted and all these things, being able to put their hands in the dirt and the soil and all these different things, being able to take those leisure walks on the beach, supervised and with someone, of course, but being able to get out in nature, that is a big part that I have found to working with residents who have dementia, Alzheimer's, any kind of cognitive issues of any sort. Getting out in nature is a big thing. They absolutely love it. It wakens them up. It changes their energy, their soul, their spirit. It does a lot for them. So you have to look at the food. How do they eat in those other countries compared to how we eat? Because even in some of these senior communities, they're luxurious and they feed you like a luxury place would. You do have all these different food options. You know, if you're vegetarian, you can have your vegetarian food. If you don't want the big meal they're serving, you can have a salad. You know, you can have those things. So for me, it's kind of a comparison between what's appropriate for that family, because most families can't afford to move somebody abroad.
Yeah.
So then it becomes, do the communities here offer those things that are holistic for your loved one? So if you know you're somebody who's looking for more whole health type of environment, then you have to ask about that. My dad is a vegetarian. What options do you have for him? My dad does yoga every day. What options do you have for him in that? How do you keep those things going? Is it one person doing all this, or is it a team of people doing it? But that goes back to what I said about I can't do it all. You know, I do exercise classes with my residents every day. However, I solicit help from health coaches and outside vendors. Okay, you come in and do my yoga meditation class. You come in and give massages to my residents once a month. So how do we incorporate? Because a lot of communities are incorporating those things. The blue zones is a big thing. A lot of organizations are implementing that into their community. So they're taking steps in the US to promote whole health, but it goes back to the education that's needed, even for the professionals that's trying to carry this stuff out. They just don't have the education they need to do it the right way, to me.
Yeah.
So
Yeah. Yeah, that's a huge part of it. And then there's also, of course, like you said, family dynamics. So how close the family is, and then knowing that wherever you place them, they can become like family to that person too.
They can, yeah.
Is that door open? Are they going to be treated, well, so that they can feel like they're family? And I know the examples that we saw, that person stayed with them until they passed away. So it's like, if you fly your grandmom to China or to Thailand or to Indonesia, Bali, wherever, and they stay, that person is assigned to them until they pass away or until, whatever. They become like their family, and they know everything about them, so yes, we're moving a lot more towards whole health in the United States. Again, we recognize, I feel like the government has started to recognize that provider burnout. And now that's why they're throwing money at people to stay home with folks, and just to keep places from being overcrowded. And one of the key factors of a blue zone is community. It's, do I got somebody I can talk to? Is the same mailman coming through every day? Is the same, Amazon person bringing my deliveries, and I get to know them. Community is a big part of longevity and why we live long. Knowing that we have Mr. Jones down the hall to check on, or my cousin Sophia 2 doors down in my apartment to check on, that's one of the factors that keeps people alive, believe it or not. And so next
Mm-hmm.
to food and exercise, community was number one on that list. And so when you think about a person who has lived their life and they've given so much to the planet already, and now as they're getting to the back end of their life, that final third or 25% of their life, how they're treated, to me, is our way of saying thank you, right, for
Yep.
everything they've done, all these
Mm-hmm.
years. But at the same time, it's honoring, looking at how we honor elders in our society. And I just feel like, although we're doing a lot, the U.S. has a long way to grow.
We
So,
do.
yeah.
We do. We have a lot more we can do. We definitely do. And I've had residents where, like I said, the staff becomes family. I had residents, even though I moved on to another community, I kept in touch. They emailed me, called me. I would go visit them for lunch to the day that they passed on. So you create those relationships, but you maintain those relationships too. Their families would call me for special events and things like that. And they have these people in the communities that they really connect to. They don't always connect just to me, but to their care staff, to people in the dining room, to, like you said, that mailman that comes every day, the guy that delivers the FedEx packages and stuff like that. So
Mhm.
we have some of those things in place, but we definitely have a lot more work to do.
Yeah. And
Absolutely.
so where can
Absolutely.
people find you? I'm going to let you tell everyone, and then let you put it in the chat as I close out. So where can they
Okay.
find you, if at all, on social media? And if they're needing, because I know you do consultations. I don't know if you're willing to go with families and walk through a facility to assist with their tours and things like that, but I think that would be great.
Mm-hmm.
Even if they did it virtually, like over FaceTime, you can still do it that way. I don't know. I'm just like putting her out there. I don't know if she does this,
Well, a lot of
but
communities do that. They do tours via FaceTime and things. And like I said, since Encore is a consulting business, I would be glad to do that if I'm in, your state or something like that. Or we could do it virtually, or you can call me and we'll consult about what questions to ask, or to go over the things that they have presented to you and say, well, kind of break some things down to you. So they can go to my website, encoremcs.com. So you get a list of the services, contact information, all of the training and things like that we offer and consulting that we do. I recently started a YouTube channel called Senior Care Matters, where we have discussions just like this. We're going to go dig a little bit deeper and just keep it all the way real over there. Talk about the burnout, talk about the things you look for, talk about just the roles of different people in the communities, and all of this different stuff. So Senior Care Matters is our YouTube channel. And then you can find me on LinkedIn under Encore Management or Senior Care Matters as well.
awesome, awesome, awesome. So while you put that, and I don't know if you could put that in the comments, especially the website.
Mm-hmm.
But as she drops that there, listen, you guys, I know this was a great, great, great conversation. I have truly enjoyed this, y'all. We talk about a lot more. Me and Chantel talk about a lot more offline. Girl, they did what today over there, girl? So
Yeah, let me
I
tell you
know, I
something.
was like, I gotta bring you in front of this audience for this industry, because we have a lot of people aging in place and a lot of people living
Mm-hmm.
a lot longer these days. And so this is information that they need. So for those of you who want the website, it is www.encoremcs.com. And again, you can find her at Senior Care Matters as well. Listen, Chantel, it's been an absolute pleasure having you. We
Thank
might need to do
you.
a part two, and
I
talk a little
definitely
bit
think
about
so.
whole health environments and specific things, and so definitely I want to say it's been a pleasure having you. I'm so glad I got an opportunity to finally get you on here, to bring you in front of everyone. And so again, if you are catching the tail end of this, make sure you save this video so that you can come back to it and kind of glean it, especially the statistics that we have scrolling across. You definitely want to make sure you got that information and share it with somebody. If you're over, I always say people think that midlife is like 50s. That's just not true anymore. There are people dropping away like in their 60s. So to me, midlife is late 30s, early 40s, if you ask me. So if you're
Mm-hmm.
someone who's already past that point, you're on the second tail end of this thing. And so you're not only aging gracefully, I hope, but you've probably got parents. If you're blessed enough to still have your parents with you, both of our parents are already gone on, but if you're blessed enough to still have parents with you, there's some information you need, and you need to pass it on to your communities as well. All right.
Mm-hmm.
You guys, I will see you guys next time. Chantel, thank you so much again for being with us.
Thank you for having me.
It's been an honor. Bye, you guys.
Bye, everybody.